Hello, I'm Matthew Weinstock, Senior Editor for Hospitals and Health Networks. Welcome to HNHN Daily's videocast series. For decades, health IT professionals have been talking about the promise of exchanging patient records electronically between providers. You all remember CHINs, CHIMPs, and most recently RIOs. Well, now the conversation has turned to health information exchanges. Although something seems to be a little bit different this time around. There seems to be a real business case for developing that interchange between providers. Not only will HIEs become an integral part of future meaningful use regulations, but health reform's push for greater integration between providers will necessitate that exchange of information. Poudre Valley Health System in Fort Collins, Colorado, has been leading the way in the state in terms of creating HIEs with other providers. I'm joined today by that system's Vice President for Information Services and CIO, Russ Branzell. Russ, thanks for joining me today.
Thank you for having me.
Can you tell us a little bit about what you've been doing at Poudre Valley and throughout Colorado in developing HIEs?
The concept of HIE really for us at Poudre Valley Health System is not new. We've been working on this for over 8 years, where we've been trying to connect our community, whether that be physicians or secondary levels of care, nursing homes. Our goal is really to make sure that we can connect that information flow or really just give access to the critical information to those that need it. But it really has changed over the last year and a half with the development of the Colorado RIO, and Co-RIO is what it's called. And the reason for that is there seems to be a catalyst now that's causing us to want to exchange data on a much larger geographic area. As the government's defined it, unfortunately actually, we've defined this by states. And with those magic barriers that are called state lines is where we're really trying to work within those right now to start the process of exchanging information throughout that state. In Colorado, we've really been working on trying to get everyone at the table, specifically all the hospitals and large medical groups, to at least agree on the principles of how we can exchange and then really drive the standards and support the standards to make sure we can work on this statewide.
You talked about how for Poudre Valley it's been an idea and a business strategy for a number of years for you. Talk a little bit about why health information exchange now seems to be a business imperative across the field.
As the model for reimbursement, as the model for patient care is changing, which it really will be focused more on an ambulatory setting and it will be focused more on avoiding certain things rather than rewarding those things, having access to that information real time will be imperative to do that, whether that be avoided admissions or disease state management. Having the entire picture of information will help with the management of those patients.
And how do you get the providers throughout the state to put aside some of those competitive tendencies to come to the table at an HIE?
Well, it was interesting. That was something I think we're doing a little bit unique in Colorado. We came together now about 2 years ago, the CIOs of the state, and we basically said this is no longer a competitive advantage. We're all doing generally the same things at this point. So now how do we do it where it really is for the right reasons, and that's patient care. And we all said we're going to do this together, we're going to do it the right way, and we're going to make sure that everyone comes along. So we started with a model in which the larger health systems and hospitals are paying a disproportionate share of the cost for this, so that the smaller facilities, critical access hospitals, secondary levels of care, small physician offices don't have to have that economic burden and say, I can't do it because I can't afford it. And at this point, we're seeing people participate at all levels. Single physician offices all the way to the largest health system in the state are participating. Some want to take a little bit of time, some want to be like us and maybe go out a little bit faster than others.
You've worked a lot with the College of Healthcare Information Management Executives, CHIME, in monitoring some of the High-Tech Act initiatives across the country. So give us a sense of where HIEs are nationwide.
Well, I think it's absolutely across the entire spectrum. We have some states that are just beginning the race at this point, and we have some that are well down the path. The state of Delaware has been doing this for years across the entire state. Again, a smaller state and maybe a little bit less complex because most of it's provided from one health system, but regardless, they still are leading the way. The state of Kentucky and several other states are really moving at a much faster pace, somewhat in pockets, but they're bringing the pockets together. What we probably see is the norm. Most states are in that normative stage right now, which is truly establishing their HIE, selecting the technology they need, getting all the players to the table to actually start working on this, and that's what we're trying to facilitate through StateNet, to have leader CIOs in every state that are bringing the players to the table, so this can be a little less difficult, because there's no doubt it is extremely difficult.
Right, and so tell us a little bit just about StateNet. It's a group of CIOs across the country, right, who are providing best practices to each other?
Well, Chime established this, and they asked if I would serve as chair about 2 years ago, where we have CIO leaders, one, sometimes two, depending on the size of the state, that serve as the lead person to bring everyone together within that state. And then, as part of that, the first goal is to get that state moving in the right direction. Share best practice, have standards, try to avoid a lot of duplication, and really try to avoid the competitive mindset and environment that would actually inhibit this. Then the next part of this is to try to establish some standards and goals to connect the states. So as I said earlier, I'm extremely concerned that we're doing this state by state. If you look at the 50 plus states, because you've got District of Columbia and Puerto Rico and so many other places that are involved in this, it's going to be extremely difficult to glue this puzzle together when we're finally done with it. So we're trying to avoid that.
Right. Well, Russ, I appreciate your time today.
Thank you very much.
Thank you. I'm Matthew Weinstock with Hospitals and Health Networks. Be sure to tune in to hhnmag.com for more coverage of health information exchange and other critical healthcare issues. Thanks.